Hey everybody, welcome to my channel. My name is Dr. Takova Wallace-Gay. I'm a clinical pharmacist in the primary care setting, and I'm also an associate professor. I teach medical students, and I wanted to hop on real quick on the live and just kind of chat for a minute because one thing that I keep hearing, I do a lot of community talks, and one thing that I hear often, really two things. The title of this is Big Pharma The Problem. And I hear a lot of people saying like the pharmaceutical companies are targeting us or whatever. And I have thoughts about that. Maybe not what you think, but I have thoughts about that. And then the other thing is someone came to me recently and was like, the healthcare system is the sick system, like they want to keep us sick, right? And so I really want to just talk about those two things real quick because number one, because I'm a pharmacist, people assume that I am going to always recommend the medication, which is so not the case. I'm the person that is very slow to take medication because I understand the why behind them. And I think the more you understand, the better off you are when it comes to managing your medications and determining whether or not you should be on something or if you should come down from a dose or increase a dose or recommend to change to something else. And so, like, for example, if I have a headache, I'm usually like, I probably have a tension headache or I need to drink some water and I need to rest rather than immediately being like, well, I need to take some Tylenol or some ibuprofen. So it's things like that where just like small nods and people don't always understand that like a lot of times we are the last people that would recommend to take a pill or to just go and have a procedure done. And I mean, sometimes that stuff happens where like the algorithm says do this, and you know, you may not want that, or you may have to advocate for yourself in a different way for a different approach. And just take your healthcare provider is a member of your team. So just take that and do the best that you can with it, but you have to have as much knowledge as you can going into it. So I first want to address the whole like big pharma is a problem, because I mean I think that there are situations where I would agree like the pharmaceutical companies. I mean they make a lot of money. There's a lot of money in it, in making medications. There are rare conditions that don't get as much funding for developing drugs and things like that because they're not going to make as much money down the line. But while I know that that is something, I mean, there definitely needs to be drug cost reform in this country. And this is not what I want to get into in this, but like you can't talk about one without the other. So there definitely needs to be drug cost reform, but also like it's kind of like why me getting mad at somebody for capitalizing on a behavior that I am providing or doing towards them. Like it doesn't necessarily make it right that they're capitalizing on it, but also like maybe I should modify my behaviors. And so if you think about the medications that make the most money, they're all around heart stuff, not cardio, cardio and heart are the same thing. They're all around heart stuff and like weight management, cholesterol, stuff like that. And there are absolutely situations where people need these things because of genetic factors that cannot be helped, like type 1 diabetes, for example, even metabolic issues that people have that lead to weight gain and stuff like that. Like we know that those are issues. And also, like there's an and in there. And also there are situations where we can modify risk factors and reduce the need for certain medications. And so the pharmaceutical companies are making a ton of money, not just the pharmaceutical companies. I mean, there are companies out here that just started making GLP-1s just cause. And there's some issues out there in the universe with that now too, with some lawsuits and stuff. But people started making these drugs to make money because so many people were using them. And there are a lot of people that need them, but there are also a lot of people that could modify lifestyle. But it's so much easier to take the medication. And so I think there has to be a balance there in like taking the medication and making sure to implement lifestyle things, because I get a lot of comments on my videos that are like, we need to be teaching people about nutrition. And I'm like, I agree, but it's harder to change a lifetime of habits, the way that you eat, the way that you move your body, and how often you do that, and getting into the habit of doing that, than it's harder to do that than it is to take a shot or take a pill. And so I will often tell people, like, while you're working on yourself, let's go ahead and start this medication so that we can reduce your risk of having something else. And so, yes, pharmaceutical companies are making a lot of money off of these things, but also I think we can meet somewhere in the middle and implement more lifestyle factors for ourselves so that we aren't as reliant on the medications moving forward. And again, there are just going to be some medications that we are always going to need. I have a video dropping this week about anticoagulants. If you if you've had a clot, or if you have AFib, like, you are probably going to need an anticoagulant, something like warfarin or apixaban. And that is what it is. You don't have to take it, but just know that taking it will reduce your risk of having a stroke or a heart attack significantly. And so we just know that that's the case, and we want to have medications that are life-saving and beneficial. And so they're making money off of that, because sometimes we can't prevent the clot, for whatever reason. But there are other situations that we can. And so I don't always think that big pharma is the problem. I think we also need to take some ownership of what we're doing as well. And then one final thing, this will be a quick live, but one final thing is that somebody was saying that the system wants to keep us sick. And I'm like, I don't think that that's the case. Like, I'm a healthcare practitioner, and I work with a ton of physicians and nurses and nurse practitioners, and we want y'all to be well, like we do. In fact, when patients come in and they pile on the problem, it's like it's hard to know what to prioritize to fix sometimes, or what's the priority for the patient. And so we want y'all to be well, because number one, it helps improve metrics for the hospital if we have people that are improving and that are doing well. So there's an objective reason for that. But also, like, your insurance company does not want to pay for you to have bypass surgery. Your insurance company does not want to pay for a 5-day hospitalization from a debilitating stroke. They would much rather pay for the $20 pill, or the dietitian visit, or the gym membership. So, I don't like that narrative is out there that healthcare practitioners are wanting you to be sick, that's what we care about, because it's not. And I can tell you, just from like a medical healthcare professional standpoint, that's not what we want. Even the hospital systems, yes, the system, makes money, but the system also, you would be surprised how much money hospitals lose by people coming into the hospital for different reasons, or having to stay for a long time and things like that. So, yeah, we don't want people to be sick. Keep that in mind. So big pharma, perhaps a bit of a problem, but not by themselves. We have to take some ownership. And two, know that lifestyle factors matter, and your insurance company can pay for your gym membership. They can pay for a dietitian. They can pay for a psychologist to help you modify your behaviors around food, or around smoking, or whatever issue that you may have. And so use those things. Let me know what you think in the comments.